Hello and welcome to the program. My name is Marie Yambo. Our social media handles at Marie Yambo at KBC Channel 1 on Twitter, KBC Channel 1 TV on Facebook. Would like to hear from you. Now, lymphedema is a swelling caused by a lymphatic system blockage. The condition is caused by a blockage in the lymphatic system, which is part of the immune and circulatory systems. Now, lymphedema is most commonly caused by a lymph node removal or damage due to cancer treatment. Currently, there is no cure for lymphedema, but there are effective treatments like physiotherapy. Now, Ruth Gachanja, a breast cancer victor living cancer-free for the last 15 years, developed lymphedema after her breast cancer surgery. She's here to share her experience. Victoria Musyoka Choi is a lymphedema specialist, the only certified one in Kenya. Now, Evan Zombari is the director, Ken Pharma Healthcare, that deals with compression garments used for managing lymphedema. Thank you so much for gracing our studios today. So before I even talk to Ruth about her experience, with the lymphedema after her breast cancer surgery, I'd like to start with you, Victoria. What is lymphedema?
Lymphedema is basically accumulation of lymph fluid in the tissues, which happens as a result of interfered lymphatic system function. This can be as a result of removal of lymph nodes or the lymph vessels are underdeveloped. And lymphedema can either be primary or secondary. Primary, it's as a result of genetic malformation. Somebody develops lymphedema when they're born, or others, they get it at their teenage, and others get it at the year 35 years. That is what we classify as primary lymphedema. It just starts swelling, especially on the lower extremities. And most people, when they look at it, it's like the leg is swollen, there is nothing which can be done. And majority of them, they think actually it's witchcraft, but it's not. Then we have the secondary lymphedema, which as a result of surgery, either removal of the lymph nodes. It can also be as a result of cardiovascular issues, can be as a result of renal function, dysfunction, can also be as a result of radiotherapy. Okay.
And again, just for our viewers to understand the function of the lymphatic system and how any interference with it can actually cause lymphedema. In simple terms, swelling could be any part of the body. So the function of the lymphatic system.
The lymphatic system is actually part of the circulatory system. The circulatory system has three components, and one of them is the arterial side, which carries the oxygenated blood. Then we have the venous side, which carries the deoxygenated blood. Then we have the lymphatic side, which carries the large molecules in the blood, which cannot be able to pass through the venous vessels. So the function of it, we say it's like a pool cleaner, because it takes up the large molecules in the system which cannot be able to pass through the blood vessels. And then number two, it also acts as an immune check. When you have infection in your body, you will always get your lymph nodes swell. And that gives you a signal that your body has an infection.
So is it correct for me to say in simple terms, our lymphatic system is like the sewage system, because it actually removes toxins and all that?
Yes.
In simple terms.
In simple terms, it's like a sieve.
Okay, it's like a sieve.
Yes.
So let me talk to you, Ruth. I mean, 15 years cancer-free. Can I say congratulations? I do thank God for that.
Thank you.
It's not an easy journey. It was never an easy journey. Yes. But then you developed lymphedema. Yes. I can clearly see your arm is swollen. Maybe you could tell us your experience.
Yes, I noticed a swelling of my arm, and at the time I wasn't sure what was happening. When I drew my attention to the doctor, he sent me to Victoria to go and have a look. And then she told me that was accumulation of the fluid as a result of my surgery, which was mastectomy, where they removed my breast, and at the same time removed where there is a cluster of 21 lymph nodes. They removed 14 and only left 7. So as Victoria explained to me, when the fluid gets there, there was a narrowing, so it tends to accumulate down there.
Interesting enough, people might look at the glove you're wearing and the sleeve, and they think like it's something that anybody can get anywhere. But actually, it's a medical garment, you know, and that's where Evans comes in. So Evans, talk to us about these garments, you know, the sleeve and or the garments, can I just put it, that are used to manage lymphedema.
Thank you very much. So Ken Pharma, we provide a one-stop shop that provides solutions to patients with what we call CVI, chronic venous insufficiency. Though today we are talking about lymphedema, the two are more or less related. So these are not normal garments. They are medical compression stockings and compression arm sleeves like what she is wearing. So what makes this very unique is that that garment is like a pump. It's like a muscle pump. Okay. Once you have a lymphatic disorder, your lymph nodes are not able to, lymph fluid is not able to move freely. And so it needs something like a pump that periodically will push the lymph fluid through the system. This is just, Victoria, one of the ways of managing. There's also the physiotherapy, yes, that you do when, yes, the patient comes to hospital. You'll talk to us about the management of it. But even before we get into that, there are different types of lymphedema. You can touch on them, but then as you do that, there is also the issue of edema. So somebody sitting back at home might be like, oh, I normally get a swelling whenever I sit for too long. Does that qualify me to use the compression, the garments or not? So maybe you could actually talk to us about that.
Thank you, Marie. So like I've said, we have two different types of lymphedema, which is primary and the other one is secondary. But now we usually, in our assessment, that's when we stage them. We usually have stage 0, stage 1, stage 2, and stage 3. So stage 0, it's when somebody is just a candidate that might be able to get lymphedema, but has not developed lymphedema. Stage 1 is where now they start developing lymphedema, and it disappears with time. And that's where most of the people get swelling of the feet. They lie under stage 1 because it just comes. Sometimes it may be dependent on the factors, contributing factors. Maybe somebody sat down for too long, and because of the gravity, they had swollen legs. And then once they elevate or wear the compression stockings, it just disappears. That's stage 1.
That stage 1 also is very important because it could be a risk factor to other things, especially, I want to believe, if it happens frequently.
If it happens frequently, it's a risk factor, and one needs to be done a scan actually to be checked whether the lymphatic vessels are functioning very well. And in Kenya, we have one facility which offers the lymphoscintigraphy, where they inject a dye and you see how the lymph fluid is flowing. Oh, okay. So when you keep on getting that stage 1 lymphedema, it's very important to be checked just to know whether your lymphatic system is functioning well or not.
So at what point then do you decide somebody needs to, number 1, inculcate the physiotherapy, and secondly, to wear the compression garments?
I will say it starts from stage 1. Stage 1, we will also recommend the compression therapy, and we'll also recommend the stimulation of lymph nodes, which is part of the treatment, and we call it manual lymphatic drainage. So in simple terms, we say that the treatment for lymphedema, we call it complete decongestive therapy, and it has various components, and one of them, the first one, is patient education. Yeah. Because once the patients understand their system and they understand how to manage and how to prevent lymphedema, then they don't develop lymphedema. Okay. And then the second stage we go, it's basically if they have developed lymphedema, then we do the manual lymph drainage, which involves stimulation of lymph nodes in different areas. We have lymph nodes in the neck, we have lymph nodes in the chest, we have lymph nodes in the axilla or armpit, we have lymph nodes in the groin, have so many lymph nodes in the abdomen.
Okay.
So we basically train them on how to stimulate their lymph nodes. Then we also advise them on the use of compression therapy. Compression therapy can be in form of bandaging, can be in form of stocking or the sleeves, and can also be in form of a pump.
Now, during our discussion, Victoria did mention that one of the ways of managing lymphedema is by physiotherapy or by complete decongestive therapy. So, Victoria, what do we have here? I can see you have a lot, of these garments over here.
So, Marie, what I have here, it's part of the compression therapy. But as I said, management of lymphedema can either be conservative management or through surgical intervention.
Okay.
The conservative management is what we use, a complete decongestive therapy. And the surgical intervention needs more debulking, which is not really available in Kenya.
In Kenya at the moment.
So the conservative management involves stimulation of lymph nodes. I said that we have many lymph nodes in the body, and what we do is that we start by stimulating the lymph trunks, which are basically just at the neck. We have the lymph nodes up under the ears. We have lymph nodes on the axilla. We have so many on the abdomen and others in the inguinal area. So that's a procedure which we first start by stimulating the lymph nodes to make them more active so that they can be able to take up the excess fluid which we are draining.
And definitely this you do when
leg.
someone is lying down.
Somebody
in
when
the
he's
hospital.
lying down and relaxed.
Okay.
And then after that, depending on the stage, like I said, if one is at stage 2, which has formed what we call fibrosis, which is hard tissues, we need to break those hard tissues so that we can allow the lymph vessels to be able to allow the fluid to pass. And that way we use bandages, and the bandages are usually short stretch bandages. So like these ones, it's only used for the fingers, so we wrap around the fingers to help compression of the finger and to allow the movements, because we don't want it to be stiff. And then it's followed by a compriform, which is basically applied to help in breaking the hard tissues. And then this follows, which is a short stretch bandage. The short stretch bandages, they go with sizes. So the smaller the size, the smaller the part which we are going to apply. So at the wrist, we start with the smaller bandages, and we advance getting to the bigger ones, and at the top, we apply a bigger one. The reason is because we want the compression to be graduated so that it can be able to push the fluid. At the wrist is higher, then as you get to the elbow, it decreases. As you get to the shoulder, it is 40%. That allows the movement of the fluid. Then we have the compression sleeves, and the compression sleeves, this is the way they look. And if you look at it, you will find that here it's narrow, so it gives more pressure here, and that it goes up, it goes increasing in size because it takes the shape of the arm. Now, at the leg, we have compression for the legs. You can have the flat knit, which is what we call custom made. For people who have lymphedema, which is advanced, we can make stockings which are basically just designed for the patient, because in Kenya, sometimes you find that we have nice legs, which they are bigger at the thighs, and somebody has very narrow legs.
So it can be tailor-made.
So it can be tailor-made, depending on the measurements. We also have these ones which are custom, which are ready to wear, and one can be able to buy them easily at Ken Pharma. Okay,
now the one that Ruth was wearing, can you demonstrate to us how she's supposed to put it on? Because you also mentioned that that's sometimes a challenge for some people to wear them properly.
The compression stockings go with sizes, and one thing which I would like to advise is that one should be taken measurements and be able to know their sizes when they are wearing the compression stockings. So I will be able to demonstrate this, and Ruth was wearing a compression sleeve. Yes. And this compression sleeve, we usually provide also compression wearing gloves. Okay. These gloves, the advantage with them is because they have a grip. And if you wear this compression sleeve or stocking without this glove, it becomes very cumbersome. Okay. And that is one factor as to why when many people are given these compression stockings or sleeve, they don't wear them religiously.
Okay,
they
so this
find
helps
it
with the
difficult.
grip?
So this helps with the grip, and you train the patients on how to wear them. And once you have the glove, they pick it very easily and becomes very easy to wear and put on. It will only take few minutes to wear. But if without that glove, somebody will say it takes like 20 to 30 minutes for me to be able to wear that sleeve or the stocking, and I cannot manage. I just have to forget about it. And that shows that they don't comply.
So the stock and the glove this is just to help with the grip.
To help with the wearing.
Okay. Yes. Okay. So after she puts on that, is there something else to...
After she puts that, we usually have the compression glove, which is basically for the hand, because most of the time you will get, either you can have a sleeve which has the thumb, but it doesn't give any compression at the wrist. So if they don't wear this, then the fluid will backflow to the area where there is no compression, and then it reaccumulates at the wrist, and many will say, you know, when I wear that sleeve, it actually makes my condition worse. Why? Because they see the fluid as reaccumulated on the wrist, and the hand has become more swollen. So this glove helps to offer more compression at the hand, and that pushes the fluid uniformly back again to the heart.
Okay. Thank you so much for that demonstration. So the last thing that Ruth has to wear is the glove.
It's the glove.
Yeah, and definitely, like you can see, it's not, the fingers are out. It's not the same as the glove that she's using to manage, to grip the sleeve.
Yes.
So Ruth, you've been using the compression, the sleeve and the gloves for a while now. How has that helped you? Has it changed, your experience when you didn't have it? I don't know whether you're not able to use that arm. So how has it helped you?
Using the garments helps a lot, because I notice when I am even a little late in wearing them, my body just feels heavy. And then fluid starts accumulating, especially under my armpits, and it can build to an extent where it looks like a balloon, and I guess that can even make me feel a bit sickly in the body. So wearing garments gives me a lot of comfort, and I'm able to move around. I feel comfortable, I am at peace, and I'm able to move around a lot.
There's no medical cover that caters for these medical commodities. What's your take on that?
Well, I think we have to start with NHIF. NHIF does not even cover physiotherapy sessions.
Yes.
Yes, and they do not cover for any materials. So I think there's need for
them to relook into it.
To relook into it. I know some professional bodies like the Physiotherapy Council are looking at that, so that these products are zero rated. Because if you're paying about 70% of the FOB cost on taxes, that is going to be very expensive. So the government needs to look at NHIF. I'm sure they're doing that. Then we need these items zero rated, so that at least their patients are able to afford them.
And Victoria, number one is the cost of just taking care of lymphedema when somebody has it. But then there's other problem. In our introduction, we said you're the only certified specialists in the country. That is quite shocking. So I'm wondering what happens to the patients who are not able to access, quality healthcare when it comes to management of lymphedema. I do not want to ask the question as to why, because that could be open another discussion altogether. But what are the dangers then that these patients are undergoing?
Thanks, Marie. So the dangers with the patients undergoing is that most time the condition is misdiagnosed, mistreated, and mismanaged. And I will say that lymphedema is one field which it's called lymphology field, and it's not really well understood. And most of the time, not many people want to take interest in it. I got interest in it, and I will say that it's a stepchild medicine now in Kenya, because with that, I managed to collaborate with Lymph Africa Education in South Africa, and right now we are training 14 people at Amref University to become certified lymphedema therapist in Kenya.
Okay. Yeah, and I think Evans, you're also involved in that.
Yes. JUZO, which is one of our partners, in partnership with Lymph Africa and Victoria, is the one that has sponsored the 14 students.
In essence, when there's mismanagement, definitely also, the quality of life is also impacted for these patients who are not able to afford, number one, to, access a qualified, personnel, and definitely the government also that's too expensive to afford. So, Ruth, probably you could, let us, what word do you have for people out there?
What word I have for people out there, especially breast cancer patients who have had their breasts removed, I would advise them to have a look at themselves. Make a habit of looking at yourself so that you can notice when your arm is, the measurements between your normal arm and the other one is changing. I have personally picked out quite a number of people. I have a habit of looking around when I go to a hospital waiting room, and I have picked quite a number of them. Unfortunately, a lot of them don't seem to know, and it would be nice for the doctors to, when they are preparing the patient for this operation, to let them know what to expect and what can happen and what to look out for. I have picked a number of them, but they think it's just a swelling, and because it is painless, they think it's okay. I have picked some, and where they have, then when I tell them they need to go for physiotherapy, they need to wear this, and they say it costs a lot, I have personally taken people to Victoria and paid for their sessions, and even taken off my glove and put it on somebody who I have seen, and they were not aware. So, and they have really appreciated. So it would be nice for the doctors to educate the people and even to hold a session and let people know.
Evans, your parting shot?
Thank you so much for inviting us. I think such interviews will be really important in creating awareness. I think this probably is the first media interview that we're having about lymphedema.
And we'll have many, many more.
Yes, so that will really help, because I know there are so many patients who are suffering out there and they don't know where to go. They end up going to spas. Victoria can attest to that, because if you have a swelling, you think you go to a spa, it's going to help.
Or for a massage, for that matter.
Exactly, which makes it worse. And so having a media coverage like this is really important. And number two, I would like our JUZO stockings to be available to the entire population that is having this challenge. Only if the taxes are removed and they are easily available and affordable to everyone.
Okay,
yes.
Exactly, easily affordable and available to everyone.
Yes.
It's part of the medical commodities.
Yes.
So hopefully those in charge hopefully have had, and they'll do something about it. So thank you so much, Evans, Victoria, and Ruth, for coming in and sharing your experience in as far as lymphedema is concerned. Thank you also back at home for taking your time to tune in. Hopefully that you've understood what lymphedema is. And if at all you suffer from edema once in a while, it's also a good place to start, just to find out whether there is any other problem that could actually lead to anything more complicated. So thank you so much for taking the time. If you've missed any part of this program, do tune in to our social media handles at KBC Channel 1 on Twitter, at Marie Yambo, and also on our YouTube channel. So thank you so much. Until next time, I'm Marie Yambo.